Why here? Why now? What are we doing? I will start in 2014 from a United Way perspective to say, at United Way, the Greater Lehigh Valley, we set a bold goal: reduce food insecurity by 50% by 2022. We knew at the time that 70,000 people in the Lehigh Valley were hungry. It was according to surveys here locally and produced at the national levels is a common number, is the number we saw today in the video. And what we learned was that a multitude of organizations and groups were working on the same thing, building momentum in the valley to impact the community. So a little bit about straight to some results. The blue on the bottom is Lehigh County, the red on the top is Northampton County. Here's the good news. Food insecurity has gone down over a 3-year span, from 70,000 to 69,000 the following year, to an amazing 62,500 people food insecure, and just released a couple of weeks ago. This is at the most recent count, and how has this happened? We can come up with several reasons. People have come up with several reasons. Maybe end of the recession, an increase of wealth entering the Lehigh Valley. Maybe we're just a mirror of the national data. We are. It has also gone down nationally, at least by little bits. But truly, I believe that this wouldn't be happening without the mutual effort of caring people and organizations across the valley. So in a minute, I will talk about the work of a dozen organizations and hundreds of valley residents that came together to build what is now called the Lehigh Valley Food Policy Council. Jessica mentioned the Policy Council earlier in our tour. And I need to say, before we celebrate anything at all having to do with food insecurity, let's think again about 62,000 people who are hungry in the Lehigh Valley and food insecure. It's 9% of the population, and still enough to completely fill the Iron Pig Stadium 6 times. And consider this. At just over $3 per person per meal, complete access to an adequate supply of nutritious food for everyone in the Lehigh Valley means closing a gap of $35 million in our community. Or redistributing $35 million in our community. And this is just in Lehigh and Northampton counties alone. This, to me, demonstrates that we need a systems-level approach, a poverty-reducing solution, such as more jobs, more affordable food and other commodities, and yes, affordable housing stock. And this is very strongly how the two issues that we're talking about today are linked together. We now have an economic imperative. This affects all of us, not just people in extreme poverty. And in fact, over a quarter of the food insecure people in the Lehigh Valley do not qualify for state or local benefits. So 25% in Lehigh County, 39% of the people in Northampton County are enough above the poverty line that they cannot use SNAP benefits. They cannot use any of the federal or state or local benefits available. So what do we do about that? We're stuck with some choices. I'll mention briefly the inexpensive cost of fast food. So those who have been lately to a Taco Bell or a McDonald's, every single time I go, and I say that not to say it's every day, but it does happen that you end up at a Taco Bell or a McDonald's. It's very cheap food. It is really inexpensive food, and it fills you up. And I don't need to talk for a long time, and it's not the only factor by any means at all, but it's how you default. And that eating fast food does not mean it still can mean that you're food insecure, because the definition of insecurity is that you don't have access to healthy and nutritious and affordable food. It's not simply having availability of food. So let's move to solutions. These are all, I will read them to you, you don't have to read them, are all active strategies taking place right now in the Lehigh Valley. So we have choice pantries, nutrition education, summer meals, farm to institution, food reclamation, healthy corner stores, farmers markets, CSAs, that's community supported agriculture, farmland preservation efforts, mobile markets, double SNAP, we saw the video on that today, farmland preservation. And this picture here is the Eat Real Food Market, which was mentioned in the Double Snap video. It's by the Kellen Foundation. All of the things that I mentioned are solutions that are happening right now in the Lehigh Valley. These are all things that are taking place. I'm just going to pause for a second. I'm going to go back and show you the different pictures that I have had up. So we have the Eat Real Food Market here. that you see? Okay, we go back one. This rooster, who took this a couple years ago, it may not be alive today. Hopefully in a food insecure belly, now secure. Willow Haven Farm, which does serve several of the farmers markets around here and is a CSA that's inside of the Lehigh Valley. This picture here is Taproot Farm, so it's also, that's also a CSA. And they produce, it's a young couple actually, they produce all of their own food. They have a couple of, from what I can tell, between 4 and 6 people run the entire shop, and they do Philadelphia market, they do Bethlehem, they do a few other cities, I believe they might do Reading, and they're part of the Buy Fresh, Buy Local network. This is the Rodale Institute. They also have a CSA. They also provide farm to institution, farm to table to several restaurants. The Rodale Institute does a lot of work beyond that. This in particular, I believe, was one of the farm to table projects. And here we have kale. This is Bechtolt's orchard at a farmer's market last summer at one of the newer farmer's markets, at least last year, the Bethlehem Rose Garden Farmer's Market down the street from my house. And this features, you'll see the Buy Fresh, Buy Local sign. This features the Double Snap program, as does the Eat Real Food Market. So any place, more and more, any place that you can go and buy food using SNAP dollars, Double Snap is more and more available. My kids again. So that's just a little tour of live solutions that are happening right now in the Lehigh Valley. And here's the great thing about food access solutions. So at United Way, we've been tracking farmers markets and healthy corner stores as 2 measures of success. We have others, but we thought, let's find a couple measures, track them, and sort of see what we can find. And you'll notice here that between 2015 and 2016 alone, we have what I believe to be incredible increases in both farmers markets and especially healthy corner stores. And I will credit Lehigh Valley Health Network for a lot of the work in the healthy corner stores here. And here's sort of the theme of what I have to say. When you take that multitude of organizations, Lehigh Valley Community Foundation, United Way, Two Rivers Foundation, Lehigh Valley Economic Development Corporation, the Planning Commission, CACLV, Buy Fresh, Buy Local, New Bethany Ministries, the Monocacy Farm Project, Renew Lehigh Valley, Easton Hunger Coalition, City of Bethlehem, St. Luke's and LVHN, really the entire Lehigh Valley, when you all decide at the same time to address a single issue, you really can see exponential growth. All of these things are things that have happened since 2014. And it's not because United Way announced a goal. It's because United Way and Buy Fresh, Buy Local and CACLV, New Bethany Ministries, all of these different organizations. Northampton County Economic Development at the time was a really strong player in this. So you can see, even without a lot of effort, when everybody works towards a single vision at the same time, exponential growth. Not going to read or explain this to you, but I do want to say that we do have a Lehigh Valley-wide coalition. It is called the Lehigh Valley Food Policy Council, and we do have a structure. And what you see here is called a theory of change. It's a planning tool, especially when you work with social change. In the early days, the Food Policy Council was sort of saying, well, we all think something should happen with food insecurity, but really what should we do? United Way invested in a strategic planning effort to form what is now today called the Food Policy Council, no less than 48 outcomes or goals which span across every aspect of food security, production to distribution to consumption. And today, nearly 400 partners in the Lehigh Valley fit into this framework in some way. The candidates from today fall across this continuum. You'll see production to distribution to consumption across the bottom, and those are the names of the working groups. What it says doesn't matter quite so much as to know that you go from one place to another to grow the food, to transport it, to get to consumption. New Bethany Ministries Choice Food Pantry and Buy Fresh, Buy Local's Double Snap program both squarely fall within the urban agriculture and food access, more towards the consumption side of the spectrum. The Monocacy Farm Project rests between production and distribution. So they grow the food and they also find really good places to take the food. They're a supplier of fresh foods to pantries, shelters, and more. We do have to think beyond the food, though. Remember the $35 million number? This is my clean segue into housing. Food access is tied to economic stability, a big part of which is affordable housing. So I also sit on the steering committee of the Lehigh Valley Regional Homelessness Advisory Board. And the next few slides pertain to who is homeless in the Lehigh Valley. And these numbers immediately will look very small. I'm just going to say that right now because we heard there's 9,000 people visiting emergency rooms across the valley. So there's much debate with any number that you ever see in terms of how you're defining it and all of this. What I am going to give you now is the nationally recognized definition of who is homeless. That's what guides the dollars that come into a community, so I think it's fair to share those with you. 702 people homeless and 467 households. How do we count homeless people? Officially, we count homeless people. Literally, we count people without a home. We do include shelters. We do not include doubling up or couch surfing. Still, in 2016, we did count 700 people in Lehigh and Northampton counties alone. That's in shelters, under bridges, encampments, and so on. Just to break this out, so this is people in adult-only households. You'll notice that in adult-only households, no children, mostly emergency shelter, although a good portion in transitional housing and a decent portion unsheltered as well. Households with children, at least at the time that we did the count, you do a count all in one day, nationwide, walk out into the streets and count people, and that's how it works. And so when we did the count, there were 0 families that were unsheltered. There were more people in transitional housing than in the emergency shelters. So if you're going to compare the two and analyze them, you have more families in transitional housing, you have more individuals or adult-only households in emergency shelter, but there is some, play between the two. Here's the next slide. Okay. There's a couple of factors here, just to sort of breeze through. We have 54 people are in chronic homelessness. This is in 2016, 39 veterans. So chronic homelessness is long-term homelessness, okay? 39 people are veterans, and 36 people are victims of domestic violence. And just looking at those 3, homelessness has actually declined. So same as food insecurity, we're seeing a decline since 2015 in each one of these demographics. Again, it's no time for celebration. These numbers are widely believed, and in fact, The Guardian even reported this year about how we do this count in the United States to be a stark underrepresentation of the issue. I see a lot of heads nodding, and we already heard data to the contrary. So it's true. And we have tried to go about the effort of a true count in various different ways. One thing that we've done only in the last year is started something called Youth Count. So we've counted for the first time the number of youth who are couch surfing, which is not in the other count. And what we have found was that 46% of the youth that we surveyed, it's a separate survey than the other count, were couch surfing out of the 162 youth that were surveyed. Those are all homeless youth. And we learned just in the video earlier that 40% of those youth are also LGBT. I also just want to mention the other demographic that hasn't been mentioned is emergency winter sheltering. There's 3 emergency shelters across the Lehigh Valley. And I was conferring with Brett, between 100 and 200, depending on the night, are collectively in the Lehigh Valley during the winter months, staying in one of those 3 emergency shelters on any night. It's definitely 100, it's probably over 100, and it has been up to 200. And then we have this bit of information here. We also know, through another way of counting, that 300 people, right now, this instant, have nowhere to go. We, after 2 years of coordination, the Regional Homelessness Advisory Board developed a method for a single waiting list in the Lehigh Valley. And it would seem that nothing is impressive about a waiting list except that we've never had a single waiting list before. So we know through doing this, I won't go through the process of how we created this, it's called coordinated entry But what we know is that in only the first 3 months of having a single waiting list, we already have this number of people, and it's already risen to 400 since I've last counted. In January it was 100, and so I have Diane saying it's now 400 people. And this is really, this is one of the first times that it's really hit home for me. I routinely read the census, I see data a lot, and this particular piece of data, right now, 400 people, is to me really impactful. We saw the video from Pine Brook Family Answers, and as they sort of demonstrated there, and as our other housing partners know, we need much more than shelter, right? We need case management, we need mental health services, we need financial literacy, job training, we need more than that. Often the issue isn't just that we need more beds. The issue is more that it's hard to transition people out of beds in a shelter because of the availability of the affordable housing stock. So it has more to do with where is it that people are going to live in the Lehigh Valley than it has to do with, okay, how many beds do we need and should we be building more shelters? The solution is actually not to be building more shelters, it's to be looking at the full household economy across the Lehigh Valley. So I'm going to show you the structure of the Homelessness Advisory Board. I'm not going to go through it. And I think I'm going to basically wrap up because the rest of what I have really could go deep into what this is called the RAB, R-H-A-B. Instead of RHAB, we say RAB. But we could go pretty deep into what our plans are and strategies are to be able to address the issue. I can tell you that region-wide, so more counties than just the Lehigh Valley, we do have a goal to reduce homelessness by 50%. And that gets into how you count homelessness. But it's really good to have a bold goal, just like in food access. It really helps me when I tell the story of what's happening. And it also helps to have these 4 bullets here, which is how it is that we will go about addressing this goal. So I think I'm going to stop right here. I'm not going to go into the politics of housing first, which could be an interesting conversation for those in the know. And really what I have to say is this. You have experts here in the Lehigh Valley, here in this room, dealing with this issue, who really understand it. If I've learned nothing else by participating in 2 region-wide coalitions addressing these 2 different issues, it's that we know what we're doing, and we know that we need more resources. So with that, thank you all so much.